Hi there, I'm Dr. Jason Lipscomb, and I'm a dentist here in Fredericksburg, Virginia. In our office, we offer dental sleep apnea therapy, and one of the things that we do in our office is help screen people to see if they may possibly have symptoms of sleep apnea. One of the tests that we use in our office is called the Stop Bang Screening Test. Now, this is just for screening, it's not meant to diagnose, but it's a nice little test of 8 questions that we can ask somebody to see if they possibly have sleep apnea. So let's go through the test really quickly and let you take a look and see if you have any of these elements in this test. Now, the first portion, the S portion of the stop, is do you snore? People with sleep apnea often do snore, but not everybody who snores has sleep apnea. But it is a big determining factor, and it is present quite often in people that have sleep apnea. The second question is, are you often tired? Do you feel like you're just run down during the day, or do you often fall asleep during the day? People that have sleep apnea often are tired. They don't get the quality sleep that most people do, and they often wind up being tired during the day. Now the third one, it says, has anybody observed you stop breathing in your sleep? Now this is a big red flag, and if somebody has done this, it may be very likely that you have sleep apnea. So it's good to ask your bed partner if they have observed you, or if somebody that's been around while you've fallen asleep has observed you do this. If you have, you definitely need to get in and get checked out for sleep apnea. The fourth question is, do you have high blood pressure? Many of those with sleep apnea have high blood pressure, and some people that are being treated for high blood pressure haven't even had the question about sleep apnea asked, so they may not even know that they have sleep apnea. The two go hand in hand very well, so if you are being treated for high blood pressure, that is definitely a risk factor for sleep apnea. Now the fifth question starts the bang portion of the test, and some of these questions might be offensive to some people, but it is the truth about our health these days and what we need to address. The first question is, do you have a high BMI, or a body mass index over 35 kilograms per meter squared? That's pretty much saying, have you gained weight to a level where you have a high body mass index? You can calculate your body mass index, your BMI, at the link provided below. But the BMI is not, they've come out with recent reports saying that the BMI is not a good barometer of your actual health. Many people with a high BMI are actually very healthy individuals, but it does play a part in sleep apnea, because if you do have a high BMI, a lot of times the tissues and the structures around your airway get larger, and they can obstruct your airway. So it does play an important part in sleep apnea. Now, the sixth question is, are you over the age of 50? As we age, our muscles, even the muscles that work around our airways, become more relaxed and do not have the tone of a younger person. So when these muscles relax, it does make us more prone to have sleep apnea over time. The seventh question is, do you have a large neck circumference? Sometimes a large neck circumference, the size of your neck, may mean that you are getting some blockage around the airway, your airway, and those tissues and structures that surround the air coming in, and may make sleep apnea more prevalent. And the last is, what is your gender? Sleep apnea is more prevalent in males, but it does happen quite often in females as well. But if you are a man, you are more at risk of having sleep apnea. So we went through the stop bang test: snoring, tired, observed not breathing, blood pressure, BMI, age, neck, and gender. And if you answered yes to more than 3 of those questions, then you do run a higher risk of having sleep apnea. So it is a good idea to come in and visit us and let us take a look at you. We can do a take-home sleep study that is not a diagnosis, but it is another great screening tool that we can help to decide whether you are a candidate for sleep apnea treatment or not. In our office, we do provide dental sleep apnea therapy, so we provide the use of oral appliances and oral mouthpieces that hopefully can improve your sleep apnea. Sometimes we will have to send you to a sleep physician. You will have to have a diagnosis from a sleep physician to really move forward with treatment. But our office can often be the first step. So give us a call at 540-373-1641, or you can also visit us at sleepfredericksburg.com. Thanks.